I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I am thrilled to welcome back Dr. Paulhus, the world authority on the dark side of personality. In this conversation, we discuss the adaptive and maladaptive roles of the dark side of personality in people's lives. I also really appreciate how Del talks about the limitations of self-report measures and the importance of being able to see these traits in action. And please feel free to leave a comment below. And if you enjoy this conversation, it'd be appreciated if you hit the like button and subscribe to the channel. This episode begins with my guest talking about how they tested sadism in the lab by leading people to think that they were killing bugs using a coffee grinder. Let's jump in. Can you walk through the procedure a little bit? Because I think people would be interested in it.
Sure. Yeah, we had this machine that was really a coffee grinder. And we had these little bugs that, I forget the technical name for them, but we gave them names that sort of anthropomorphized them in a cute way. So I think Muffin and Buddy and I forget the names. We tried to make them as cute as possible. And so people had to take the little container holding the three bugs, well, one bug each, and pour them in the coffee grinder, and then physically press down, and it made a grinding sound, which was actually a coffee ground in there, not the bug. And so then they had to take the next one and do all three. And it was pretty well, if you're going to do one, you do all three and ask for more. So other people, when we described what they had to do with these bugs, they said, I'm out of here. They left the room. I don't want to do this. Huge variance in the way normal undergraduate students reacted just to the instructions. And it turned out that it correlated highest with our everyday sadism measure. Although I think psychopathy also played a role, not as strong with as with sadism. So you have to come up with inventive behaviors where you actually see it happening rather than asking people, well, you scored high on the sadism measure. Would you also do all these other things? And get self-reports, correlating with self-reports. You want to see different modes of human activity. Self-report, sure, that's valuable, but actual behavioral activity is in a way the ultimate criterion that you've got something. When you've got variance in an external criterion and you can predict it with your self-report measure, success.
So how did you realize that overlapping piece between these traits was callousness?
Well, usually you start with a self-report, and when we looked at all the self-reports, we could see items on there in the measures that were around before we came along. There was a bit of callousness in each one of them. So, and logically we concluded, well, that's probably what those three have in common is willingness to hurt people. So there have been a few other speculations about what the common factor might be, but I don't think they I don't think they compete with callousness being the core. And it's interesting that manipulation also shows up on the core. It seems unfortunately part of the human character is that if you have low empathy, then you find that you start manipulating people because you find that works for you. Having no care on what you're doing to other people allows you the opportunity and the ability to manipulate people, because the breaks we were talking about earlier, is when your empathy kicks in and you say, no, that's going too far, or, oh, sorry about that. I'm guilty. I feel bad what I did. If you don't have any of that, you find, well, I can tell people lies and I can cheat and commit fraud, etc. It works for me.
Right. Yeah. I guess I'm sort of thinking there's a reason it's called the golden rule.
Yeah, yeah, that's true. I didn't think of that, but a bunch of other people did.
Yeah. Are there, can you talk about gender differences and like developmental differences in terms of these dark traits?
Yeah, I'm not a developmental psychologist, but I do know that you can track conduct disorders in children and find that a certain number of children exhibiting conduct disorders and a couple of the others that I've forgotten do ultimately end up with adult dark traits. But the road is complicated and they don't exactly map on to each other because a lot of things happen to you between the time when you're defiant and exhibiting negative conduct and your full adult repertoire comes up. But what was the other part?
Gender.
Gender, yeah. Seems like all of these negative traits are higher in males than in females. And in a way that bothered us because a very common notion is the mean girls idea. And that is girls can be nasty to each other, but they do so in different ways, like spreading rumors about each other and criticizing each other in ways they know will hurt the other person. So we tried to come up with um, a component that women would actually be higher on. And we tried and mostly failed in that. But my student Erin Buckles, who is now professor at University of Winnipeg, she's pursued that quite a bit and looked at different types of sadism and found that although verbal sadism turned out to be more or less the same in men and women, that she could find out these, she could come up with a few that I just mentioned, a few tendencies among women that are slightly higher than men. But for the most part, it's been very difficult um, for to get women to report their meanness.
So what were the things she was able to get higher in women? Like,
Well, uh, spreading rumors and cutting people in ways that hurt, those kinds of variables, facial expressions that show smugness or show disdain for somebody, those she's found are paying off and actually are higher in women's self-reports than men's. She hasn't got a standard measure published yet, but she's working on it.
got it. And so that would so is it that she's then finding um like differences on, would that perhaps be Machiavellianism, when she modifies those items, or is it just on very specific behaviors that she's finding that women are higher than men?
Well, it's been the sadism component
Oh,
that
okay.
that she's focused on, separating different kinds of sadism. That surely Mean Girls has a sadistic flavor to it, uh, picking on girls that can't stand up for themselves or who are lower in status. Um, again, it seems to be well accepted that some girls do that. So it's been the sadism dimension that she's focused on. And those tendencies that I measured do have a sadistic quality to them. And so I hope to see that in print soon.
Yeah. So, one of the things that I was wondering, and you brought this up a little bit in terms of sort of like the higher level and the lower level. What do you think about breaking down these dark traits into more specific types? And one of the ones that sort of came to mind was, and there's lots of different variations, but one of the more, I would say, popular ways of breaking down narcissism is talking about grandiose narcissism and vulnerable narcissism. Like, what are your thoughts about that?
Yeah, to me, those are so dramatically different that I true, they both have the label narcissism on them, but they're totally different in the dynamic. The vulnerable narcissist is someone with low self-esteem and just can't connect with other people. So people interpret that as a kind of narcissism because they won't engage, as opposed to the grandiose narcissist who's in your face telling you how great they are 24 hours a day. Um, so they happen to have the same name on them, partly by coincidence, I think.
Okay. Okay. So you're sort of saying they're almost like rather than thinking of them as like two factors off of narcissism, it's kind of a whole different kettle of fish.
Yep,
Okay.
that's
That
what I
makes,
think. Yeah.
yeah. Um, I just did you want to take a brief respite before we kept going, or are you good for a little bit longer?
I think I'm okay to continue.
Okay. Okay. Just want to make
Yeah.
sure. Okay, so one of the things I think there's this really fascinating story about how these dark traits relate to my word well-being, um, and specifically looking at how they relate to personal well-being. I don't know if that's, I think you use the term intrapsychic versus interpersonal well-being. Could you tell us a little bit about that?
Yeah, I think you may be alluding to people who have looked at connections between dark personalities and well-being, and um, there seems to be some ability of the dark traits to fend off depression and other kinds of uh, 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 anxiety and disturbing intrapsychic problems seem to be, uh, I find mostly they just don't connect at all with the dark personalities, where some people might make speculations about various ones, and surely that must make them uh, feel guilty or sad or miserable. But for the most part, they don't seem to connect with well-being. But yeah, you may be alluding to a couple of studies where I saw that the argument was that you can actually fend off any kind of cognitive uh, intrapsychic problems if you have the dark personalities. I think in particular, though, that may be referring mostly to narcissism. And you never know about narcissists. Are they faking it? Uh, or do they really believe this stuff? And I think it's a bit of both. I think narcissists really believe they're superior and they have no problems. Um, Sure, sometimes their life falls apart and they don't understand why. If I'm a superior being, how come my wife left me and I got fired from my last three jobs and everybody seems to hate me? Um, and so, but normally they seem to get through the problem areas since most of the problems come from conflict with others. They can either rationalize those or use strong self-deception to ignore what other people have to say. So that's all I know, but you probably know more about this than I do.
No, no, I think you kind of hit it. I think what was interesting was that I think narcissism was positively correlated with this sort of personal adjustment, well-being kind of a thing. But then when they looked at this sort of more the interpersonal adjustment, sort of or interpersonal well-being, that's where the dark tetrad seemed to have packed the punch. That's where it seemed to get in people's way. And I think two of them in particular were psychopathy and sadism that were particularly elevated. That that those traits really had these interpersonal costs to them.
Yeah, and it's been strange in the past that people have lumped them together and assumed that if you have interpersonal conflict, you must have a disturbance within your own mind. But it's pretty clear that the most hated person in the US, Donald Trump, was also elected as their leader. So people can separate those things. You can actually vote for someone you hate, and because you think they can get things done, perhaps. But yeah, the interpersonal and the interpsychic can be separated, especially in narcissists, and they find a way to do it. In a way, the funniest part strategy that narcissists use is doubling down. So if someone shows you face to face, look, you got it wrong. And I've actually seen this in the laboratory where you get people to say they know things that they don't, that can't be known. And you hold it up to them, put it in their face. They double down. Oh, sure, that's wrong. I know what I know, and that's wrong. So you can see that Trump does that on a regular basis. You'll say, sure, I'm the smartest in history, smartest president in history. And people will say, well, we looked at the polls, and they say, no, you're not. And of course, he'd say, well, those polls are wrong. In fact, I'm the smartest person in history, not just president, smartest person. So doubling down on it somehow somehow works for him intrapsychically. And the anger that comes in when you're insulted, uh, I've seen that in narcissists too, that that makes people say, oh, never mind, don't bother, and just don't deal with the person. Now,
So,
you working in the counseling department, I imagine you've had more face-to-face experiences with these four dark personalities. Do any particular examples come to mind?
I mean, I think about, the narcissists that I've worked with. I always think that they're the worst. That it's just, but I think that's just a personality. There's just a group that I find particularly, um, uh, I lack empathy towards. But then again, for just like with anything clinically, if you're working with, if you have a one-off person here or there, it's difficult to really get accustomed to or learn the skills to or be able to create empathy or, that which is different than if you're working with a lot of these folks, right? Then your clinical experience of it will be different because, the reality is that really high elevations on any of these traits, I mean, really high, the is relatively uncommon, right? So that um, so that you're not dealing with them. Of course, it's also context specific, right? If you're working in the prisons, that you're going to see more of some of these than if you're working in other places. I would imagine if you're working in the Ivy Leagues, you'd be more likely to see some of these than in other places, right? I mean, that would seem reasonable to me. And that sort of got me thinking about like the nonlinear associations with the dark traits with any number of outcomes that, right, these are, we all have some elevation on these four traits, even though it might be very low, right? We're probably not a zero. And that in fact, there are I think many people would argue, perhaps not some Buddhists, but many people would argue having a little bit of callousness, that there's value in that. Because just as you said, right, if you were solely concerned about how your behaviors impacted others, then it'd be very difficult to get anything done because you're constantly thinking about other folks. And so, but in reading your work, it did get me thinking about, are there threshold effects? Are there places where, yeah, some elevations, some variance on these constructs is fine and is helpful in different contexts, but then once it hits a certain point, that's when you're really in trouble. That's when you're not going to be able to maintain long-term relationships. That's when you're going to prison or jail. That's when you're, going from trying to be nice to your boss, right? That's sort of a Machiavellianistic kind of a thing, right? Sort of trying to have positive relationships with people who have power and that sort of thing. That's okay. And that's even probably adaptive, but it's when you're really going really far to manipulate many people around you that you're going to get yourself into trouble.
Yeah, that's a good point that I think is overlooked when you look at simple correlations, because you don't know which distinctions along the line of the variables are where the action is. And just because you've labeled the whole dimension in one way doesn't mean that the results you're getting are happening because of the way you labeled it. I don't know if I'm making sense, but if you, so we should be looking more at that. Exactly, are there optimal levels? Are there catastrophe points where things fall apart? And the distinction between our work and the people who are expert on personality disorders is key to this distinction, because they come from a clinical perspective looking for disordered minds. And so sometimes they end up with the same variables that we look at a subclinical level. But all the data that I'm concerned with is in normal people, people who have jobs, who have relationships, etc. So we refer to it as subclinical. They're at a good university, they're able to study and get good grades, whereas the people studying disorders presumably are more interested in the extreme maladaptive levels. Now, it's right at the nexus of the conflict between the old DSM and the new trait level DSM that they're pushing toward. It seems to me that there's still arguments for some categorical psychological variables where you got it or you don't got it. And things like Tourette's or um, some other psychosis, seems to me there's a good argument that there are cutoff levels, and you should be comparing below the cutoff and above the cutoff, and that's your focus, as opposed to variables that we study at subclinical levels are being studied in work populations or student populations. So we consider them all to be normal or subclinical, people who are not, who don't break the barrier of being maladaptive. So I think things are happening right now between people like us who study subclinical, the traditional clinical people who think in terms of categories, and the psychometrically oriented clinicians who want to see everything on a trait level. And I don't know how it will settle down eventually. Maybe in the next DSM, it'll all be traits, although I doubt it. I don't think certain phenomena can be handled strictly at a trait level. So lots of things to happen in the future between those three groups.
Yeah, and I've been pretty convinced, and I think your point about Tourette's and other disorders is well taken. And that for if we're just talking about the personality disorders, that the trait level approach, sort of thinking about these things on a spectrum, does make a lot of sense. And I think it's reasonable to say that, one can say low, medium, and high, and those sorts of things, and sort of create general cutoffs, which are obviously problematic in certain ways. But, it's not too bad to think about that. Like, yeah, when you're at around this level, you might be getting into trouble. That maybe we should take this seriously and think about how to help you deal with this. I had Bob Kruger, who was really involved in the sort of the trait level or continuous sort of approach for the personality disorder stuff. And I'm actually going to have him back on because they've done a lot of work with this, just with the DSM as a whole in the high top model, as they call it. Um,
Yeah.
because, as I was reading your work, and I noticed several places in your work, you would sort of say like, and we're not talking necessarily about clinical, you'd sort of like have that caveat sort of sprinkled here or there. Um,
Yeah.
but as I was reading, I was sort of like, I mean, to me, yes, sure, you're looking at it continuously. So you are looking at that range from low to high, but these, but once you hit a certain point, whatever that is, that does seem to be, likely is going to correlate with problematic stuff that I would classify as, likely clinical. And we certainly know, right? There are lots of folks who, on many indices, are high functioning, but are also suffering quite a bit, or struggling quite a bit, or have elevations in all sorts of, you know, uh, psychiatric distress. So I think, even though you're looking at university students at a good university, so these people do have to have a certain level, or likely have a certain level of IQ and conscientiousness and these sorts of things, that there's still going to be a lot of people in there who are going to have, who would be diagnosed with any number of psychiatric disorders.
Maybe, but
You're not convinced?
well, it's hard to say. And again, usually the evidence comes in some sort of maladaptive behavior happens. Um, but there's so many ways of being maladaptive that that's not totally clear, given that 50% of Americans think their president is psychiatrically disturbed. Are they right? Well, you're not supposed to be doing diagnoses from a distance anyway, but they've got all the evidence in the world. And again, in the context too, if you're a certain, what did I call them? There's certainly jobs where having a certain kind of disturbance may not be a problem. If you like punching people in the face, we can give you $50 million over the course of your career if you'll punch them really hard. Um, so what's going on there? Well, that particular job benefits from having a personality that enjoys that kind of behavior. And who are these the guys in the army that have to toughen you up? I forget what they call them, drill
Real soon.
sergeants. They are nasty. I was actually in the army for a summer, and they went out of their way to be nasty even to volunteers who were just in there for the experience. Um, and so, yeah, maladaptive or not, hard to say. depending on the particular, I wish I could remember that term, but uh, jobs or contexts where it might be called upon to have that particular kind. And again, narcissism, good or bad? Well, if you're a genius, it actually promotes you coming up with glorious ideas and ignoring people and say, it's stupid to think that people will have computers on their desktop. What a dumb idea. Everybody said that, except for one. And he was right. And if he wasn't massively narcissistic, um, it wouldn't have happened,
Mm-hmm.
at least not so dramatically from one person. Um, so um, I think your point is well taken, though, looking at possible cutoff points for various kinds of maladaptive outcomes. Although I think you'd have to specify probably pretty narrowly what that outcome is, rather than, well, there's a tipping point here for psychopathy. Beyond that, you have a disorder. Before that, no, you can get along. People won't like you, but you can get along. Um, so the criterion problem is one that psychologists always run into, psychometricians especially, where 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 does it change? Where is the change? Even Bob Hare, I don't know whether you've interviewed him or not, but he used to think that psychopathy was a category. And given that he was so important in generating interest in that construct, people had a lot of respect for that point of view. And so 32 on the PCL, and you're a real psychopath. 31, no, you're okay. But now he's joined with me in developing continuous measures. And so he doesn't say that anymore.
It, this morning, I had some rather unpleasant dental work I had to have. And as I was sitting in the chair, and of course, thinking about our conversation this afternoon, I was just sitting there thinking, I wonder if dentists are sadists. I had this moment, of like, huh, that's interesting. And then I kind of freaked out a little bit as I was sitting in there in the chair helplessly. But then as the dentist was working on me, I was like, no, I think he actually cares about how I feel. I don't think he's getting any pleasure out of this. But I did have that thought. I mean, it's sort of going on what you're saying that like, uh, that some of the how adaptive some of these traits can be in certain contexts.
Yeah, the surgeon cannot be bothered by spurting blood and horrific looking accidents. It cannot be a factor. They have to look at it totally objectively. That liver looks like it needs to be removed. That's all there is to do it. Interesting that you bring up the dentist, though, because there's immediate feedback for a dentist, which puts the brakes on their ability to hurt people. Um, to doctors, to surgeons, well, they're dealing with unconscious clients. So in some ways that allows them to do whatever they want to the body and with no repercussions. So a little bit different, but
Hmm. Hmm. So are there any other traits, characteristics that you think could turn this, could be added that you would consider, or people have brought up that you've considered as possibly fitting into this group of four and making it a group of five? I don't know how you go from, I don't know what comes after Tetrad, but
mm, Well, I do get asked that, and there have been a few nominees here and there. But again, I remember the term I was trying to think of earlier that um, analytic approaches are either lumpers or splitters. And so
Hmm.
we argue that you should split, but only to a certain degree. And so people want to add more. Really hard to say. I don't know. You're probably familiar with the big five personality traits and
Mm-hmm.
also a big six,
Mm-hmm.
which has honesty, humility in it. And that one is of great interest to us because personality space is rather amorphous. And if you rotate the dark personality traits with respect to the big six, they tend to float under one factor. And that happens to be the new one that was added, HH, honesty, humility. And
The inverse, right?
yeah, the inverse, exactly. And but big five advocates, of course, don't like that because it takes on a religious quality for some big five advocates. They believe that's it and don't touch it. So they
Mm.
want to put the dark personalities under one of the big five. And it fits best under agreeableness reversed again.
Right. Disagreeableness, sure.
Yeah. But it's also there under low conscientiousness. So it's a mixed bag when you attach them there. So it
Right, because
does
you have the impulsivity piece. I mean, that would certainly go under low conscientiousness.
right, right. That's right. Good example. And so our group has drifted toward the big six, and not that it matters a lot, but you've got large personality inventories like the big five that are supposed to cover everything at a broad level and happen to be labeled in positive ways, except for neuroticism. Um, so, uh, but for us, being concerned with the dark side, seems that they fit better with factor six, the one that's been added to the big five by Kibun Lee and Michael Ashton, Canadian guys that you could also interview if
And is
you
your
need.
sense, being a personality researcher, is your sense that the big six, which is also called the HEXACO, that is a better fit, that is a um, psychometrically a better explanation than the big five? Or is it more complicated than that?
Well, yeah, it's almost like a semantic issue of where you want to draw the line. And people have thought for a long time, well, we think there's something extra beyond the big five, but for the moment, let's stick with the big five because at least there's a consensus that there is personality, which was dubious back in the 60s, where social psychologists were saying, no, personality is not an issue. It's not of interest. And Walter Mischel, in particular, pretty well destroyed the personality psychologist with his hard work and analyses. But when the big five came along, yes, we personality people do have something to say. And there it is. So let's stick with it for a while at least. And so it's a slight modification. And as I said, the rotation of factors in personality space is somewhat arbitrary. And it boils down to utility, I think. So the utility for us is to find out what's the best match between normal personality and these dark traits. And we have preferred to go with the big six and in particular the HH factor.
What was the reason or what was the argument for there is no such thing as personality?
Um, Well, for one thing, there were 1,000 traits. What do you do with that? There were just too many. Couldn't decide. So it took some hard-nosed um, personality people who had computers and could do factor analyses, not with a slide rule or uh, just mental gymnastics, but could show with factor analysis that indeed they clustered into subgroups, and you could name the subgroups and call them meta-personalities. And they turned out to be pretty useful because they did resonate with people. Yeah, of course, there are extroverts, and they are also high in activity level and enjoyment of a variety of things. And there are conscientious people, sure. So they all resonated with people. And so finally they could say, yes, we've decided there is personality, and here they are, 5 traits. So yeah, that was before your time, but it was it was an existential threat to personality people back in the 60s.
Hmm. So we've talked some about, I don't know if pushback is the right word to your work because in talking about the D factor.
Mhm.
Um, but is there any other pushback that you've experienced towards your work?
Oh yeah, lots of it. So from both ends that we should split the factors more, um, or we should merge them more, um, and they correlate too much. And it has to be observed that when you try to repeat factor analyses, they don't always turn out the same.
Right.
You have a slightly different sample, slightly different language, then you're going to get some overlap that didn't exist before. And people believe their own data. So if someone comes up with uh, a high correlation between a couple of them, then they believe they've destroyed the entire enterprise. But no, they've just shown that variants can be partitioned in slightly different ways in different populations. So, so different members of the dark tetrad have been complained about in terms of their overlap with other members.
Mm.
But other complaints, well, everyday sadism, which we think is the most novel contribution. Um, People think no such thing. It's psychopathy. Um, and to some extent, they fall back on either it's all psychopathy, or we have a sample in which sadism correlates with other factors, so it doesn't exist on its own as a separate variable. So, yeah, you name it. We've even had people complain that calling things dark is racist because people are going to say you're promulgating the notion that people with dark complexions are evil. Now, that's a pretty desperate complaint, I think. Uh, and there have been other complaints. Well, we call certain people psychopaths when they're not actually categorically psychopathic. So if you use the word psychopath, you are making a mistake, a categorical mistake, and people are going to be misled by whatever you're saying. So pretty murky stuff, but it's pretty clear that a lot of people have resented the success and the activity level that the notion of subclinical but dark personalities adds something to our understanding of people.
Hmm. Interesting. Yeah, I was when I was working on this, I was sort of like thinking about. I was just thinking about it mostly in reference to Star Wars, the dark side. That was my that was my reference point. Um, and really thinking about when I was going down the rabbit hole about how these traits are manifested in sort of in the Star Wars universe in terms of the dark side, and it got me thinking about that. Um, so one thing before I let you go, Del, is I always like to ask folks if there are, one or two resources that for folks who are listening that want to learn more that you would, sort of point them to learn more about your work.
Well, I do have other podcasts out there, and it's interesting that you've asked me questions that the others haven't necessarily asked. So they might want to look at some of the others. Um, Even Jordan Peterson had one that was useful because he is a personality psychologist himself. So he knew all the nuances of everything that we were talking about in research on dark personalities. But there's a bunch of others out there too. Um, I could send you those links that you said you'd add them to the
Yep,
notes.
yep. Anything you have, or and any papers or books or anything that you think they're like, just let me know, and if you just I can look them up and add the full citations, but I'd be happy to add them.
Yeah, I can certainly send you a list of perhaps the most seminal papers in this area and maybe the most recent ones might be of interest. I'll send you those.
That'd be great. Well, Del, this has been fantastic. I can't tell you how much I appreciate it.
I enjoyed it too. It's great.
Thanks so much for watching. If you found it helpful, please like the video and subscribe to the channel. I'll see you in the next video where we continue exploring the science of psychotherapy and applied psychology.